Assalamualaikum. My name is Muhammad Nur Hazul Fadli bin Hassan. Today, I would like to present about my case study. The title is Identification in Infection of Stenotrophomonas Maltophilia. Introduction. The patient is male, 40 years old, Chinese. The patient complained of vomiting more than 20 times since morning. He also appeared fatigued and weak, thus had to be brought into the hospital by using wheelchair. He does not have any past medical history and not on any medication. Upon arriving, the patient had been undergoes few tests such as full blood count, renal profile, and other tests to investigate the patient condition. Laboratory finding. Laboratory finding shows patient abnormality result for the past 3 months. First is full blood count. Based on this result, the patient produced an abnormal result on the second and the third month of the following parameter include hemoglobin, total red blood cell, white blood cell count, neutrophil, and lymphocyte. Second is erythrocyte sedimentation rate. The patient produced an abnormal reading of ESR in the second and the third month of 20 mm per hour and 40 mm per hour respectively. Third is renal function test. Based on this test, the parameter that being focused is uric acid and urea, as the patient produced an abnormal result in the second and the third month of both parameter. Fourth is iron level. Patient iron level is decreasing in the second and the third month of 10 gram per deciliter to 4 gram per deciliter respectively. The bronchial lavage culture and sensitivity also being done. The culture shown that gram-negative bacilli is seen, and sensitivity testing produced a multiple drug resistance towards the infection. Amikacin level testing is also being done. However, the test is being done only on the second month, as in the first month the patient had not be given with any antibiotic. Discussion. Based on the lab diagnosis result, full blood count tests show normal result in the first month but appeared abnormal in the second and the third month, which record lowest reading of hemoglobin at 7 gram per deciliter. This indicate that the patient is in anemic condition. Thus, the patient receive blood transfusion to increase the reading of the hemoglobin. Next, white blood cell count also recorded high count, which means the patient may suffer from infection as neutrophil count is very high at 90%. Moreover, erythrocyte sedimentation rate test also recorded high count at 40 mm per hour, as it is likely to happen because of infection and also other condition. Renal function test also being tested to show if the infection have affect the renal condition of the patient. Based on the result, obviously the patient renal function may have affected, as the uric acid and urea recorded very high count. The iron level test show low level of iron. These results support the full blood count test for the parameter of hemoglobin, which the patient is in anemic condition. Bronchial lavage culture and sensitivity testing show gram-negative bacilli is seen and bacteria Stenotrophomonas Maltophilia is detected. Moreover, this bacteria is a multi-drug resistant, as only few antibiotics are susceptible towards this bacteria. With all the laboratory results we obtained, especially a bronchial lavas culture, the doctor concluded that this patient is suffered from infection of Stenotrophomonas maltophilia. The high possibility of developing this infection may come from ventilated machine of respiratory and device when transfusing the blood. This is because the device may be contaminated, thus produce the bacteria that colonize at the patient. The doctor prescribed the patient with amikacin, which is an antibiotic, start from the second month. However, patient condition is not improved and the amikacin level of the patient had increased, which may appear toxic towards patient health. As a result, the doctor stopped the amikacin treatment and prescribed another antibiotic, which is cotrimazole, which the most susceptible towards the bacteria Stenotrophomonas maltophilia. This is to kill the bacteria and improve patient sign and symptom. In conclusion, Stenotrophomonas maltophilia is an uncommon emerging multi-drug resistant pathogen that causes infection. The incidence is increasing nowadays. The signs and symptoms may not shown clearly. However, as this bacteria colonize in our body, it will produce fatal condition because it's difficult to treat. Thus, proper treatment must be given to reduce mortality by choosing right types of antibiotic. Any mixture of antibiotics that works toward this multi-drug resistance is accepted. To conclude the case study, this rare type of bacterial infection should not be looked down and must be handled with correct procedure. All team members of the hospital plays a vital role towards treating this infection. Thank you.